how old is she now?
I think 12 days old.
12 days. Oh, you're a big girl. And look at, so some babies can't even lift their arms over their heads. Yeah, they're that tight.
Okay.
And so that was great that already she's lifting her arm over her head and she's showing me all these great things she can do. So I'm going to start at the back of her skull on her occiput and just gently hold it, because with cranial work we just do very light pressure. But I'm just feeling how it moves, and then I'm just lightly pulling it away from her spine and tractioning her spine down. Does that feel good? And then I'm going to encourage her slightly to move into the area that I feel she's a little more restricted in, which would be into her right side, because that left side seems a little tighter. So I'm going to bring her a little bit into this right side and see, yeah, now she's doing that nice and easy. So now she's opening up this left side of her neck and coming into the right side. So she's all getting comfortable here. You can hear her little happy sounds. But I'm going to add a little challenge in. So a lot of babies don't, well, that I see, but I think it's true, don't want to extend back very well. And that can really interfere if a baby doesn't like tummy time. That's often going on. And you can see this little sternocleidomastoid, this muscle on her is tighter on this side, so it's kind of popping out right now because when she developed, it was pulled tight. And so we want to open this part of her neck up. So part of what I'm going to do is help her come down into extension now and really try to get into that neck, just using the weight of her head. So then I find this very often with babies is that they're not attached to their restrictions like adults. Adults like, wait, but I like being in this position. And so once we guide them and help them see that they have this extra mobility, they tend to be really happy about it, and they'll go right into it, ready to release into this right rotation. Now that's still a little challenging for her. Here we go. So now she's pulling herself into these positions, and my job is to kind of remove gravity as much as I possibly can. That was a nice breath way down into your diaphragm. So it's still a little tighter on this side, but it's really releasing nicely. Yeah. So you can see, so we also want to make sure she has movement through her thoracic spine, her rib cage. Now remember, she was upside down in your tummy for a long time, so she's totally fine upside down. Now she's a little tight in her rib cage. So she's not going to love this per se, but it will really open it up and it will help with tummy time. And this is actually what I would like you to do for homework. So you use the weight of her head, I know, and just pull her, let her drape down. I'm gonna hold her arms so you can feel a little bit more bundled. Yeah, is that a little bit more like being in your mommy's tummy? I know, it's a little hard, you're telling us, huh? Now you see her little chin still to that left side. So we're gonna see if she can come right. Yeah. Oh, look at you, that's so good. I love treating babies right about this 2 to 3 week mark because we really can stave off a lot of issues if we just get them right at the beginning. Now, babies like this little, there's circulation issues in general, so sometimes like a leg will turn purple, or you see how her neck's getting a little purple.
That's that's uncomfortable.
No, but that's totally normal, and I'll bring her up in just a sec, but she's actually doing such great work in her thoracics. I know, sweetie. All right, let's bring you up. Oh, does that feel so good? See, she wants to stay down there now. That's perfect. Oh, you trying to go back down? See how nicely she pinked back up again? I remember that, especially with my second baby. Sometimes I'd be holding him and all of a sudden, like his whole arm would be purple.
Yes.
So tummy time's gonna be really important for her. She is quite tight in her thoracics. I mean, not alarming or anything, but she's not gonna go here unless you help her. But you can tell she doesn't mind, because if she minded, she'd wake up and she'd cry. But yeah, you see how relaxed her body is? She's still, good job. Oh, now look at that. Oh, now this is like perfect super baby. Superwoman. Yeah, so now I'm going to check her diaphragm again, because sometimes there can be like a little, you know, the gastroesophageal sphincter, hiatal hernia, diaphragm tightness. She feels really good.
Now she's like taking bigger, like more relaxed.
Yeah.
Like,
Do you see that? Exactly. So this is your homework, believe it or not.
okay.
Yeah. This and tummy time. And then making sure she's turning right. So we're gonna help her turn. Tummy time's also really important before they get to where they're turning, because if they don't like it, they will turn themselves out of it. And then oftentimes I like to stabilize the pelvis, because a lot of babies will push up with their legs and do all their activity in their pelvis. And so I actually just press their pelvis down into the table or the bed or whatever surface you're using, and then have her put her activity in her arms.
Oh, that makes sense.
Yeah. No falling asleep, sweetie. We want to see some big muscles. So, this is left side. I'm going to let her just hang here for a minute and see what she does. But I might also just gently take her, see if we can see her resistance there. But because I know she can do it, because we just did it. I'm going to bring her to the right. Oh, now do you see? Now she's doing it. So now I'm going to give that pressure again. Now this is great, because she's not even quite strong enough to lift her head back up and go left. So this is actually a great moment, because if I were you, I would have her do this on her own surface at least a half hour a day.
Okay.
And then what you'll start noticing very soon, within the next week or two, she's going to really start. The goal is to push herself up on her forearms and hold up like this and be able to go one way and the other way. Now when she pushes herself up, I want to see a nice thoracic extension. So some babies, when they push themselves up, they come up like this, and then they do this. I want to see this. Do you see the difference?
Yeah.
Okay, so that's called thoracic extension. And so what you can do is you can again help with that. At first this is phase 1, right? Phase 2 would be to gently come under her chest and just move her up into extension. Oh, you're so tired. Oh, this is so much work. And I'm keeping pressure on her bum. I'm keeping pressure on her bum so she can't use her legs. So she has to use her upper body. Oh, good job. And you see her trying to get back to her other side. Oh, look. Oh, that was a good one. It's okay to be a little mad. Sometimes we get stuff done when we're mad. And then I see her, she's making her way back. So that's totally fine. And then that's enough, because we don't want to max her out. She's already done such a big job.